guys, Dr. Becky Rucker here with Physio Movement Performance. I've got Kayla here. She's the third-year intern from University of Puget Sound in their physical therapy graduate program. Guess what? I just went to the kettlebell certification course by the Pain Free Performance group, and we were down in San Diego. I learned the Turkish get-up. So what better way for me to learn it better for myself and for my clients than to teach it? So today, I'm going to be teaching Kayla to do the Turkish get-up. So she's done a few times before, but relatively new to it overall. So there's going to be some mistakes. There's going to be some things that we're looking at and correcting. But we're going to go ahead and just take her through it and kind of see how it goes. All right, Kayla's going to lay down on her back here, okay? All right, so she's going to have the right arm up and right leg up. And we're going to do it first without the kettlebell, just so she gets an idea of what to be doing, okay? So first point here is that she's going to start with her body. I mean, she's going to spread the, kind of the, make space with her body. That left leg is going long, the right leg is bent, the right arm is going to come up, okay? And we're making sure that this right heel is outside the hip in that position and kind of close into the glutes, okay? So when we drive, we're going to drive through the hip, and we want that drive to happen this way, okay? Her other arm is out to the side, kind of between the waist and the shoulder height in that position, okay? So Kayla's going to start the motion. We're going to start though by focusing on the hip drive portion, not really the rolling yet, okay? So she's going to try to keep her shoulder down, yep, and drive through the hip. And notice we have this rotational pattern of her driving through the hip in that position, okay? She's really digging that heel in, driving up to the side, okay? Good. All right, now we're going to add in, she's going to come up to her left elbow. So she's going to feel it, she's gripping the ground with that left hand and really kind of pulling herself. So it's a combination of that right glute working, kind of the core rotating the body, and also that left shoulder pulling across, okay? So let's go ahead and just have you go up to that position. Perfect, okay? Then come on back down, okay? And for her, we really focused on a little bit of that drive through the hip first. So let's go and do that again. Drive through that hip first and then pull up. Beautiful. Okay, she's in this nice position. We're also going to look at her shoulder. So I'm going to have you come around video here at the shoulder position, okay? So in her shoulder, we want to see that the shoulder is centrated in the joint. Have you come on over here and look here, okay? So she's not actually super centrated in the joint. Can you come to the side, Jen? Look in here. And we're seeing that her shoulder is forward of the joint. So I don't want her to be there. I actually want her to be back. I want this head of the humerus centered right in the joint in that position, okay? Because we're getting some stability here. We're also having some stability through that arm, okay? Good. All right. So from there, let's do that one more time. So drop back down. Good. Drive to the hip. Roll up and then focus that shoulder back so we get that, yes, beautiful position. We also want to see this nice like side lifted so she's not kind of crunched down in that position. Okay, from here she's going to go up to the hand. As she does that, the hand's going to move slightly. We're going to come on up to the hand. Good, and we want the hand to be a little bit externally rotated. Again, checking her shoulder position. I actually want that shoulder back in that position. Beautiful. Okay, from here she's going to sweep the leg through and bring it close to the hand. Okay, we want this nice position where she's close to the hand. And what we should see here is that she can lift her hand up off the ground without falling over, okay? So we want this nice hip hinge. We don't want to fall over in that position. All right, from here, she's going to windmill. She's going to come tall. Jen, I'm going to have you come around here. I have Jen, office manager, physio, video here today. Great, so she did that. Going to go back down to that side position. Good, so she's in this nice side position. She's going to go ahead and windmill up. Beautiful, okay? And she kind of moved her leg, so ideally we would not move the leg yet. So go and put that leg back there, Kayla. Good. So we want to be in this 90 position. So really when we're ending up, we're in this position here, okay? From there, she's going to take that other leg around. She's going to bring that leg around in line. Her toe is tucked underneath because we want to push off that hip as much as we push off the back leg as much as we pull up from the front leg. Notice from the side, we see a little bit of like, the rib cage, so I'm going to cue her to be a little taller here. She's looking up. Kayla's a little tight in the shoulder, like her lats are tight, so this is her end range position. Otherwise, but I can check and make sure that that's what's going to work for her, okay? The kettlebell will help to be like offset behind, which will help with that. From there, she's going to go ahead and look forward, and she's going to go ahead and stand up from that position. Beautiful. Shake out your arm for a minute just because you're up in that tall position for a long time. Okay, we're going to reverse it and go back down. Okay, arm overhead. Okay, step back into that lunge position. Good, again, I'm gonna check her rib cage a little bit just so she's in that position. All right, windshield wiper that leg out to the side. Okay, so we're trying to get this 90-degree angle between the other leg and this one. Okay, she's gonna kind of karate chop through her hips and then sit back and the arm's gonna come down. And notice when she did this, The arm came down in line with the other leg, okay? She didn't, come back up for a second. Okay, she didn't try to like reach the ground back behind her, okay? Because that actually is what a lot of people do, is they reach back. We don't want that. We want this idea that the hip is shooting back and the hand is coming down in line. Good, so we're sitting back there. Beautiful, okay. And again, I'm gonna just check her shoulder a little bit so we're getting that nice stability. Okay, sweep the leg through, and as we come through, we want the hips to sit down near the heel. So we get this nice line there, okay? From there, she's gonna go and come back down to the elbow. Good, and again, and then she's gonna go ahead and roll back down, segmentally roll. We want that nice rotational roll, using those abs, hitting each segment of the spine as we go. Okay, beautiful, Kayla, looks good. We're gonna try it with the kettlebell this time. All right, so here we go. And you're gonna grab there. All right, so we have her nice line. Again, where we want that hip, we want that kind of about right there. So outside the hip, heel close to that hip, other leg making a starfish. Okay, just give me the hip drive first, just one little thing. Good, beautiful. Let's go ahead and sweep it up, pull yourself up, good. Check that shoulder position there, good. She's gonna push up now. I'll push up to the hand, good. Okay, and then from there, she's gonna go and sweep that leg through, bringing the knee close to that hand with a nice sideline position. I'm gonna check her shoulder. Good, is she in line? Is that in line with her body? We want this centered right over the joint. We don't want her hanging out here. We also don't want it hanging out here or anywhere else. So right over that joint. Good, from there, she's gonna windmill up. So go ahead and right up, good. Windshield wipe with that leg in front of you, so it's right in line with the body. Toes are tucked under. She's gonna go ahead and stand up. Beautiful. Okay, go and step back. Actually, take a break, Shake your arm out for a second. Okay, looking good. All right, back up again. Okay, connect that ribcage down a little bit. Good, step back. Good, windshield wiper that leg out, open to the side. Good, getting that 90-degree angle the other leg. Good, she's gonna kind of karate chop back through the hip, reach down in line with that. Perfect, sweep the leg back through. Glutes come down to the heel, that position. Good, and then she's gonna go ahead and come to her elbow. Good, and I might check her. She didn't have exactly the beautiful, I'm just gonna lean back a little bit that way, okay? Good. And then she's gonna segmentally roll back down in that position. Good. Okay, awesome. So what was this for? This was a lot for shoulder stability. It's a great shoulder stability for the arm that's working. We're working on awareness of where the shoulder is in space. We're also working on the opposite arm, like it's having to stabilize the body as we're lifting up. We're working on movement patterns, like muscle coordination, lots of things. So it's a great exercise just to kind of supplement your overall training program to build like foundational shoulder strength, but also mobility through the body. We're getting some abdominal work as we're rolling. We're getting some hip mobility as we open the hips, strength through the legs as we stand up. So if you have any questions, we're going to be working on the Turkish get-up a lot over the next few weeks. So any questions, shoot them my way. We'd love to hear from you.